I'm calling Natali. I'm a consultant orthopedic spinal surgeon working at the London Independent Hospital, which is one of the BMI groups of hospitals. I suppose you could consider the London Independent Hospital to be a little gem in the East End. It's a hospital that has an ITU, it has a high dependency unit, so it can take all types of patients. It has MRI and CT facilities and can do very simple to very complicated operations. One of the questions people ask is, should you see an orthopedic surgeon for your spine or should you see a neurosurgeon? The simple answer to that is it doesn't matter who you see, provided they're spinally trained. Back and neck pain in the United Kingdom costs the country about £13 billion a year. That's a very significant amount of money, and rapid treatment and rapid assessment can make a big difference with your final outcome. Lots of people might be concerned why they're seeing a spinal surgeon right at the very beginning of their history, and the simple answer to that is that what patients need is they need rapid assessment and they need rapid treatment and advice. Very few of the patients that I see actually need spinal surgery, but the imaging that they have in the form of MRI scans, which allows very precise and detailed diagnosis to be made, allows patients to understand what's wrong with them and to get on with the treatment. Patients who come and see me are typically patients who have back pain, neck pain, they may have had whiplash injuries, they may have lifted things at work, they may have leg pain, sciatica, lumbago, a whole host of disorders. One of the problems that they're having is lots of these patients have severe pain, they're often very young and very concerned about what the diagnosis may be. One advantage of seeing a surgeon early is that we can arrange for MRI scans to be performed, and the scans themselves can actually give us a precise diagnosis. From there, the patients can have physiotherapy, analgesia, they can have injection therapy, or ultimately, in a small group of patients, they may require surgery. Spinal surgery, around this time, is now going through a massive revolution. We actually have new techniques for doing the same operations. We have minimal access techniques, which means that we can insert screws and cages into the spine with very small incisions. The advantage of the small incision means that patients have less tissue damage, they have less bleeding, they're in hospital for less time, and they recover far, far faster than ever before. We can do the same operation far more effectively, and patients benefit. Another modern technique that we're using is robotics. Robotics is a really rapidly evolving technology where we can use CT scans that are taken here at the London Independent Hospital. You then program it and allow the X-ray arm that you use in theatres to allow insertion of the screws. It makes these spinal screws very accurate, it reduces error, reduces patient harm, and reduces the need for any further surgery. Most patients who have back and neck pain, it's just due to disc degeneration or diffuse problems with the spine. There are a particular group of patients which constitute things like red flags. These have to be excluded quickly. Red flags include severe pain that doesn't get any better, pain associated with weight loss, with a fall, such as a trauma, a fall from a height, or in patients who have night sweats. An important feature that people should look for is bladder and bowel disturbance or numbness around the inner part of their thighs. If anybody experiences these symptoms, they should seek urgent medical advice. A common condition is sciatica, which is pain that radiates from the back down to the leg and typically below the knee. One of the problems with this condition is that the pain is extremely severe, it can be very disabling, and getting access to care can be very difficult. There's very good evidence that in the first part of treatment you should receive painkillers and physiotherapy. The problem is that if it goes on beyond 6 to 8 weeks, then you should seek specialist advice and you should consider surgical intervention. Lots of patients are very concerned about having spinal surgery. There are lots of bad stories about spinal surgery, but modern spinal surgery is extremely safe, it has a very low complication rate and a high success rate. A common question that's asked is, how long am I going to spend in hospital? For an operation such as a discectomy, patients are normally in for 24 hours, which amounts to an overnight stay. For spinal fusions, you may be in for 2 or 3 days, and certainly with minimal access surgery that we perform here at the London Independent Hospital, you're usually only in for 2 days. That's a dramatic change from what happened 10 years ago when patients were in hospital for 2 weeks. Just because somebody's had spinal surgery doesn't mean that you're going to get better straight away. After surgery, you often need additional painkillers for a short period and sometimes physiotherapy. the majority of spinal surgeons will refer somebody after surgery for physiotherapy so that they can be assessed and receive the necessary instructions on what to do and what not to do. One of the problems in the United Kingdom is that as a population we're getting older. As you get older, your bones become less strong, they become brittle, and through daily activities such as lifting things or for small falls, you can sustain fractures of the vertebrae, the building blocks of the spine. If this happens, the majority of patients will get better over a 6-week period. A small group of people, unfortunately, do not improve and they suffer from severe pain. Here at the London Independent Hospital, we perform a procedure known as a vertebroplasty. This means that as a day case, patients can come into hospital and under sedation they can have a tube inserted into the vertebra and cement is injected into the body of the vertebra or into the fractured area of the bone, and that reinforces the bone, allowing patients to conduct their life normally. Lots of patients with low back pain who don't get better with physiotherapy and painkillers will benefit from injection therapy. The injections are conducted as a day case. It allows us to inject steroid into targeted areas using X-ray control to relieve patients' symptoms. Patients with back and neck pain often ask, what should I do if I have the neck and back pain, and how can I access extra treatment? If you present to your general practitioner will be able to provide you with a referral form which will allow you to be seen here at the London Independent Hospital by one of our specialist team. Why should you see a surgeon if you have back or neck pain? The majority of patients that I see never have surgery, but what it does is it allows them to have a discussion about the cause of their back and neck pain and to give them a reliable treatment pathway. There is a condition that can affect young people and can be particularly severe. It often occurs in patients who have been very athletic as youths, and it's an insidious form of low back pain where before patients were able to exercise and all of a sudden in their 20s and 30s start getting more and more low back pain. The condition I'm referring to is a spondylolysis or a spondylolisthesis. This is a small fracture within the spine. It doesn't cause instability and doesn't cause paralysis, but what it does cause is pain, and it often goes unnoticed and untreated. For patients that are concerned about a spondylolysis or a spondylolisthesis, they need further investigations. Plain X-rays often don't pick it up, and you need a CT scan or an MRI scan. Obviously, this has to be requested through a specialist centre such as the BMI Hospital, the London Independent. Patients who have a spondylolisthesis or a spondylolysis often respond to physiotherapy, and once the diagnosis has been made, specific physiotherapy exercises can be provided. A small number of cases fail to improve, and we try injections first, but in a small number, approximately 1 in 20 patients, surgery may be required. With the advent of minimally invasive surgery, we can do this through very small incisions in a very reliable and safe way to enable patients to get back to health as fast as they can.